Healing. Healing body's response in the injury of the healing wound is combination of regenerated repair of tissue. Wound healing can be accompanied by following way: healing in first intention, healing in second intention, healing by first intention, first union. It is healing of wound which has following characteristic: clean infection, surgical incised, without much loss of cell and tissue. Edge of wound are approximated by surgical suture. Sequence of event in primary union: initial hemorrhage, acute inflammatory response, epithelial changes, organization. Initial hemorrhage. Immediately after injury, the space between the approximate surface of the wound is filled with blood which further clot and heal the wound. Acute inflammation response occur with 24 hours, which is characterized by appearance of polymorph at the margin of incision. By Mind day, the polymorph are replaced by macrophage epithelial changes. The basal cell of epidermis from the cut. The incisional shape. A well approximate wound is covered by the layer of epithelium in around 48 hours. This margin epidermal cell separate the underlying healthy tissue from the overlying necrotic material by forming a scab with a cast off. By fifth day, the multi-layer new epidermis is formed. Organization. By the third day, fibroblasts also invade the wound area. By fifth day, new collagen fiber start forming in fourth week. The scar tissue with scanty cellular vascular event is formed. Suture track. Track mainly might happen that we will have to close the wound in the surgical suture. Each suture track is separated wound heal with some process of primary wound healing. Healing by second intention, secondary union. In the defined healing of wound which following characteristic: open wound in large tissue defect which may be infected, having extensive tissue. Wound which is not approximate by surgical suture but it's left open. The basic event in secondary union are similar to the primary union, but the difference is having large tissue defect which has to be bridged. Therefore, the healing type place from the basic upward as well as from the margin inward. Hence, the healing by secondary intention is comparatively show usually result in scar formation. Also, the sequence of event in secondary event mainly include initial hemorrhage, inflammatory phase, epithelial changes, formation of granulation tissue, wound contraction. Initial hemorrhage. As it result injury, the wound separate is filled with blood in and fibrin cord which dies in inflammatory phase. Inflammation. There is an initial acute inflammatory response, followed by the appearance of macrophage which help to carry off debris. Epithelial changes. The epidermal cell form both the margin bound proliferation, margin inward. They meet in the middle epithelial gap completely. However, this proliferation epithelial cell do not cover the surface completely until granulation tissue start space wound braces. Meanwhile, the aggregated epithelium form scab which stratified keratinize granulation tissue. Bulk of secondary granulation. Fibroblast nervous collagen, nearly form granulation tissue. Granulation very fragile. As the healing process, there is increase the collagen fiber, decrease in vascularity. Wound contraction. Contraction of the wound is typically characteristic feature of secondary healing due to action of fibroblasts which are present in granulation tissue. The wound contraction to 1/3 or 1/4 of this original size. Factor affecting wound healing. Local infection, the pathogenic contamination of the wound. The various bacteria lead to release of toxin which may dissect the granulation tissue, lead to formation of slug, purulent discharge. Due to this, wound healing is delayed. Age. The children, the wound healing is fast as compared to the old age. Menstruation. Wound healing is delayed due to the important nutrition also. Vitamin C is essential to synthesis maintaining of collagen. Zinc also play an important role wound healing. Poor blood supply. Wound over the knee shine of heal slowly as compared to wound of the surface which heal fast due to good blood supply. Uncontrolled diabetes. Wound healing is delayed in such patients to several factors like microangiopathy, proliferation of bacteria due to high blood glucose level, decreased phagocytic activity, etc. Hematoma. Presence of hematoma may hamper healing process. Radiation. Exposure, ionization, radiation healing by the granulation tissue formation. Hematological abnormalities, defect in neutrophil, blending disorder, slow down the of wound healing. Movement of wound, movement over the wound area delay completely. Foreign bodies. Presence of foreign bodies interfere with healing process of cause inflammation reaction. Complication of wound healing. Infection. It may be get infected due to entry of bacteria which delay the healing. Ugly scar. It may be occur due to inadequate formation of granulation tissue. Pigmentation. Healed wound may sometimes have rust-like color due to staining with hemosiderin. Incision hernia. The weak, especially after the laparotomy, may be site of raised incision. Keratinoid formation hypertrophy in mainly occur due to excessive formation of collagen may result in keloid formation. There may also formation of hypertrophy scar which are usually combined to the wound bacteria or margin.